start now. So welcome everyone. For the umpteenth time, I am Kristin Liabo and I'm calling in from Exeter. And I'm here chairing this seminar, but the seminar itself is going to be, the presentation will be by Will Lammons. Do you want to wave, Will? We'll hear from you very shortly. And Raj, Mehta, do you want to wave as well? Thank you. And then Stan, who I think many of you will know, will facilitate a discussion after the presentation. Now, we are currently 64 people in this call, so we will do our best to be inclusive and pick up when people want to say something or have a comment to make in the chat, but please bear with us. If we miss you, it is not intentional. We will just do our best. So these seminars were initiated by Elspeth Matthews and her group at the University of Hertfordshire, who were keen to start a seminar series that focused on research that has been done on patient public involvement. Stan was the first speaker last year, just under a year now, and then focused on their research on the people who work as PPI facilitators. That was really profound and emotional, certainly for me. It's not often I feel like I'm being researched, and it was really a positive experience. And I think there was like echoes from that research throughout the PPI community, I would say. Then we had another seminar that focused on emotions in PPI work and the emotional labor. And here we are now focusing a lot more about impact, which is a different thing, but I think all of these things hang together. I want to recognize that we're in emotional times at the moment. Funding and changes to the landscape of research, but also national policies, international situation can feel very precarious. So let's enter into this seminar in a spirit of generosity with the assumption that we're all here for goodwill and the intentions to tread kind of lightly. But at the same time, it is fine to ask critical questions, of course, but we can just ask them in a respectful way and with the intention of curiosity rather than judgment. Okay, so let's do our best. It's absolutely lovely to see everybody here. We're now 71 people. There might be more coming, but I'm going to hand over now to Will, who's got a Mentimeter question for us, first of all.
I'll go ahead and put the Menti details. So it's just menti.com. It's in the chat. We have a 8-digit code with a space in between. Looks a little bit like a postcode, but just with numbers. We'll come to that in a second, but it's in there. There's a few more chat messages, so I'll just send it again, just for convenience. How are y'all doing? It's good to see everybody. Good to be with everybody. Let's get rolling. Let's, as I like to say, let's dive in. Let me get all my doodads going. Can everybody see my screen? Can everybody hear me? If at some point you cannot hear me or you cannot hear Raj, please just get on the mic and start reading whatever dictionary you have within arm's reach, and I'll take that as a meaning that you can't hear. So today's talk is entitled, "What does impact in patient and public involvement mean? Reflections and findings from a narrative review." I'm joined today by my dear contributor and my friend, Raj Mehta. So let's dive in. What to expect today? We're going to touch on why we did this research, how we conducted this study, what we found about impact, our reflections from public involvement, and our lessons for future research. And then we'll have a little discussion. Our goal today, me and Raj's goal, is to leave with a deeper understanding of what PPIE impact really means. And before I really kind of do introductions, I would like to say that Raj and I did what we call co-produce just this talk today, which basically means that I pulled a draft together, I sent it to Raj. Raj had a big edit of it. I did all of Raj's edits and other edits that were inspired by Raj's edits. I sent it back to Raj, and Raj sent me more edits. And we met a couple of times and talked a lot out loud about what we wanted this to look like and sound like and everything. So give you a good look under the hood. So I might be talking a lot in this. Raj will talk some, but we are the whole kind of heart that is speaking from this is comes from both of us. So my name is William Lammons. I am the PPIE lead from the NIHR ARC North Thames. I've been in that role for just over 3 years, I guess 3.5 years now. I've also been doing more and more research, focusing on research design, evaluation, impact, that sort of thing. And I'm very humbled and excited to be able to present this today. It's great to be in the lineage of other researchers, or I guess in concert with other researchers working on critical sorts of things in PPI. I really appreciated Kristin's opening message of kind of around what I might call grace, or what me and Raj might call grace. I can see Raj grinning. Um, yeah, and like the importance of kind of respect, but also critical questions. Raj, would you like to introduce yourself?
Oh, thank you, Will, and good afternoon, everybody. Really nice to be here, and a real pleasure and privilege to share this experience and reflections. So I'm a part of a research advisory panel within ARC North Thames, and have been a member almost since the start of that. Since the start of the ARC, as it was then called Clark, so nearly 10 years. It's amazing. And I'm also a member of a number of other ARCs that you guys may have seen me elsewhere, including the Pen ARC subset called the Perspex. Um, I'm the research advisory panel is a diverse panel. We'll talk about that a little bit later on. But my background, I live with sight loss most of my life. I've lived with sight loss. And my professional background has been in oil industry. I'd worked for BP, where I had senior leadership roles in the areas of procurement and IT. And I retired several years ago, and since I retired, I've also had several other chronic conditions, which kind of strengthened my passion in health and social care. And I have a number of voluntary roles in the trustees as a trustee in local and national charities. And that's really a very quick summary about me. Back to you, Will.
Raj. So, and just to reiterate, we've worked on this project to explore and improve how we understand and evidence impact in PPIE. Raj is presenting with me today because Raj and I meet a lot kind of for different things, and we end up talking about a lot of these things. Raj also attended a handful of different collaboration sessions kind of throughout the course of the project. So yeah, our first time has come. Our first Menti question. Are you a researcher, PPIE professional, public contributor, or a combination of these or other? Our Menti, please go to menti.com and put in our Menti code 61892386. We just want to get an idea for our audience, just to get rolling here. I'm gonna jump to our responses. Come on, y'all, I don't have any answers yet. Da-da-da. I
Well,
get another
I'm
question.
sorry to interrupt your presentation, but when I went to the Mentimeter, a question came up about whether I think we should measure impact, not the question that you're describing.
Well, that's
Yeah,
how it's
same
supposed to
here too.
happen.
Sorry.
Okay, let's do this. I don't know why they are out of order. Hold on a second. Ash. Thank you, Mel. Thanks, everybody. Don't answer that question. That question is for later.
Thank you for pointing it out, because I was getting confused as well. So.
Okay, I don't know why I did that one. Da-da-da. Let's try this. Okay, try it now. Do you get the right question? Are you a researcher or PPIE professional? Did you get that
No,
one?
I've still got the
Everyone needs to
original one.
refresh the page.
Please refresh your page.
Yeah, I
Refresh your
got the
page.
correct one now.
Yeah.
There we go.
Hey.
I've used Mentimeter so many times. I don't know why this is happening like this. Thank you, everybody, thank you, everyone, for your grace. We really appreciate that. So, Raj, I've said the question about 5 times now. Raj, we have 16 researchers, 10 PPIE professionals, 2 public contributors, 9 combinations of these, and 3 others. Went up to 17 researchers and 10 PPI professionals, 2 PPI contributors, 9 combinations, and 3 others. They're all in wonderful. I don't think this is a histogram. I think this is a bar chart.
Yeah.
Because there are spaces in between the bars. So they give you a good idea of our audience. Oh, 3 public contributors now. 18 researchers going up and down. You get the idea. Any thoughts, Raj? Is that what you were expecting?
Oh yeah.
Can everybody? Am I still sharing correctly? Good. Okay, cool. Let's go ahead and continue. I'll make sure to get the next one right. Thanks again, everybody. So background. Bless you, Maria. Please mute for us. Thank you. Background, context, rationale, and why we did this research. Sorry, every time the chats pop up, my things jump around. So why this research? Lots of PPIE work was happening in our organization, but there were some questions around what the actual impacts of this were. The reporting of this often focused on the activities themselves as opposed to the outcomes or kind of what resulted from them. We needed a clearer picture, and we really wanted a clearer picture of what changes were happening as a result of meaningful PPIE. As a kind of part of this process, and I think it was always there at the beginning, but really now we think of impacts and outcomes as the flip side of the genuineness of PPIE. If the relationship and the activities are genuine, then clear things will come out of it. Clear things will happen as a result. Our problem to solve in this is to understand, to document, and strengthen the value of involvement. There's a lot of Raj in that one. Where are we coming from? So a little more kind of historical, kind of policy kind of context. This has been shaped over decades. What PPI is, what impact is, especially, and why it's being pursued in the ways it is, why we are told to pursue it as researchers, as PPI professionals, etc., has changed because of clear things over the years, and I'll get into that. The framing matters. How we define these things, how we kind of look into impact, how we pursue this, it really matters. So I'm going to take you back to Margaret Thatcher. Margaret Thatcher had a big impact on the health system and on research through the promotion of what's been called new public management. This is when you apply business strategies to public sector organizations like the NHS. It was a bigger emphasis on value for money. Other elements of this included more power amongst senior management. More performance audits, more benchmark checks. Also, and this has always sounded very American to me, patients are like customers. They are consumers of health services with a right to choose. The 90s Labor government added a different kind of piece to this. They added what some authors have called a human face to new public management, meaning that they encouraged collaboration between different bodies, but they continued and beefed up these performance reviews and these metric reviews. This has still continued into the recent decades, most recently with David Cameron's government's work on big society and active citizens. Both of these were ways to encourage the public to help solve the problems created by cuts to services. I was working on this project at the time last year when Rishi Sunak was trying to roll out his compulsory citizen service in April, May of 2024. Even Wes Streeting recently, our Department of Health and Social Care Secretary, has been talking about creating an army of NHS volunteers. So this kind of mix of top-down value for money, what are we getting out of this amidst cuts, amidst using members of the public and volunteers to also deal with the needs and cuts. That's where we find ourselves in terms of PPI and also in terms of impact. So what did we want to know? We wanted to know how impact is defined and measured. What kinds of outcomes are reported? What's missing from our current reporting? Yeah. Raj, did you have anything to add to all of the context things that I just ran through?
I think the other bit that kind of we haven't actually spoken here, but we discussed a lot, is whilst this was happening in the 80s, 90s, and similar things were happening in the industry. There's lots of discussion on outsourcing, downsizing, all of that kind of thing. But that happened, if you really examine it, actually, it was a lot of it was a collaborative, and some would say even was co-production, working with the suppliers to make that happen. But we have not covered that ground here.
Thanks, Raj. I really appreciate that extra context and that extra background. All the more reason to have diverse perspectives in all of this.
Yeah.
So let's get into how we actually did this study. I, through the support and guidance of some wonderful colleagues, was kind of directed towards a narrative review method, a narrative review of reviews. So very important to acknowledge this is not a systematic review. It is unsystematic. The systematic review tries to capture every single thing. This is not that. The strength and the advantage of a narrative review of reviews is that it can provide a compelling picture of the current literature with time and resource constraints. A team of one person can do it instead of, and you can do it in the course of 6 months or so. So this is a huge advantage for me. My goal and what I actually did was to review as many relevant reviews as I could. This included systematic reviews, scoping reviews. There was even a bibliometric review. Once I have the reviews, I had to go through what's called a pragmatic evidence synthesis, basically where you create summaries and themes that can connect and synthesize all the evidence that exists in all of these reviews for my questions. The search, this is always helpful for people. We did 3 iterations of searches with all of these 3 steps. So you use combinations of terms, usually kind of 2-element terms like impact and PPIE. I also searched databases and used cited by functions. That helped a lot, where you're actually going through the bibliography, finding things, and then kind of searching backwards, put the citation in and say who has cited this. I updated my search terms periodically. A couple examples of those are consumer involvement, co-production outcomes, focuses on outcomes. Consumer involvement was not a term I had ever heard of before. So I literally kind of that's a fun example of an older one that you don't hear very much more, but is still in use in some cases. For narrative reviews, you report the hits, so the search hits. It had over 36,000 hits combined. There are 27 reviews that I ended up including in this. And my inclusion criteria, because this is also really helpful, it had to use a review method. It had to be a scoping review. It had to be a systematic review. I don't think I had any narrative reviews kind of going off the top of my head. There was a bibliometric review, that sort of thing. The reviews had to be on public contributors in research, service design, or delivery. It had to be about that. It had to be looking at how people had involved them. So each review is going to have 10, 15, 100 different studies kind of represented in it. The reviews had to document outcomes or impacts of the PPIE, of the patient and public involvement and engagement. The analysis, so it discussed this periodically with our RAP members, just like Raj, shared the results with them periodically. I went through all of the reviews, extracted all of the impacts, the outcomes that they reported, their categories and subcategories of impacts into an Excel document. And I looked at the connections between these different impacts and these categories. And I collapsed them into one another. I created themes and categories based on these connections that could represent narrative points, that could represent kind of more broad represent these findings within them. What thing could capture all of this? And I wrote summaries on the key points. This was my whole thematic evidence synthesis process. I wanted to talk about the PPI elements. We held 3 wrap sessions at key moments in the project. First, we did one in May of 2023 with the wrap panel. This was an initial kind of ideation. We tied it in with, it was kind of a big session. So we did a reflection on how we do PPI as a North Thames organization. It was a great time for kind of critique, reflection, what's working, what's not. But we arrived kind of at impact as a theme, and there was real support for it and curiosity around it. So some of the kind of questions that I ended up pursuing came out of this first wrap session. In October of 23, we had another session, and I updated, I shared a new draft, and this focused solely on impact and clarify the questions. In 2024, after I'd done a lot of the searching, presented the findings from the reviews, got people's thoughts, and I ended up restructuring the discussion session in the paper. I'll share the paper citation at the very end, but you can look, and I don't name people, but I do kind of reference this wrap session and people's thoughts and what was valuable to them in it. Raj, so you were in a few of those sessions. Did you want to add anything about those PPI elements or about the search and the analysis process?
But I think it was really what I recall and reflect on it is about really our involvement, which was in a sort of way actually similar to how we participate in other research. So even though Will was our researcher here and also a PPI lead, it actually was quite an interesting sort of dynamics for Will and the group, because we were now working with Will as a researcher and actually really, understand and collaborate with him on this particular research. So it was a really interesting exercise for us all. And I think the other thing to recall is about really how the voice of panel was actually then taken on board to actually examine further as you progressed. And that was.
Raj, can I ask you another question?
Yeah.
So I remember you and other folks on the panel being interested in this as a research topic, as a concept. Can you just say a little bit about why you think it spoke to y'all, to maybe to you personally, but also in those discussions? And I know we have a couple of rap members here. If y'all were at, I know a couple of y'all were at some of those, please shoot a chat message in with your thoughts. It'd be great to have it alongside. Go ahead, Raj.
Yeah. I mean, I think the biggest thing is we wanted to hear how our voices were heard. What impact did it make? And by impact, what changes was it making? How would we know what change it made? And that was becoming quite concerning because, everybody was so passionate about it and contributing with energy and passion and so on. But those changes, how, you hear that there have been changes made, but we had no real way of recording what those changes were. We were recording the meetings, we said, you said, and we did, and this kind of things, but it still was a gap which sort of said, here is what we actually changed.
Awesome. Thanks, Raj. I think that really puts people in the room. So now let's go in the correct order. Let's go back to our Mentimeter. Let's see if I can do this right this time. So are you, that's the next one. Here we go. Should we measure impact? So please go back to mini.com, our code 61892386. Let me figure out how to share this. I feel like a radio host. Put it on the screen for us. Okay, should we measure impact? We got 42 yeses, 0 no's, and 4 unsures. 45 yeses now. Sorry if we've poisoned the well on this one. Influenced everybody's thoughts. 47 still going up. Okay, so we have a good idea of what our audience is thinking.
Yeah.
I do think I am really interested in the there's 5 unsures now. Okay. 5 green unsures, 6, but still 0 no's.
Mm.
That's really interesting. I like the should we measure it as kind of a question though, kind of an ever-present sort of question. So let's go back to our discussion. Let's get to the actual findings now. So what did we talked about the analysis? Let's talk about the actual results. What did we find in all of this? This is the magical 4-piece categories of impact that we came to. This has already had some good kind of impacts amongst researchers and PPI folks. By that I mean some researchers have already started using this in their kind of regular practices. So the first, and I'll go through the 4 top line ones, and then we'll go through each of the subcategories. So it's impacts on people, impacts on research, impacts on services and systems, impacts on PPIE processes. Within people, we have PPIE collaborators, researchers, policymakers, managers, healthcare staff, and research partnerships. And the last one I know is a little, smashed together, but that's life sometimes. Then within research, we have initial stages in design, delivery, and dissemination and implementation. Do want to note that not everybody used that perfect, beautiful NIHR research cycle. So this was a good way of kind of capturing that variation. And then on the impacts and services is a little more straightforward. The first one was service development and improvement, and then system, societal, or policy level change, and then health services, which includes products, outcomes, and decisions. And then there were no subcategories for PPIE process. So I'll give you I want to give you some really good examples across each of these 4 categories, and then I'll give you our conclusions and we'll go to some questions. So for public collaborators, just examples of impact we saw across all 27 of these reviews. Feeling empowered, improved knowledge or understanding of their condition. For researchers, it was things like improved relationships with patients and families, deeper empathy for research subjects, and for policymakers, etc., it was greater value for user involvement. Negative impacts. I want to make sure to highlight this. I've highlighted this throughout all of them. Negative impacts for the public included feeling marginalized, disempowered, intimidated, disappointed, or reliving difficult experiences. For researchers, it was pressures and tensions around time, money, and pressures and tensions around disagreements with public collaborators. Also for policymakers, it meant slower and expensive production times. Impacts on the actual research processes. So this is the most commonly reported category. Things like shifting agendas and foci to the public, improved research feasibility, things kind of more traditional kind of things like improved recruitment, consent processes, both in terms of numbers and in terms of kind of quality. Accessible and relevant research dissemination. Negative impacts, again, included frictions, disagreements. Impacts on systems and services. It increased the system's effectiveness and their processes. Things like record keeping, data sharing, medication dispensing, care pathways, appointments. There's general improvement for quality, insights into patients' needs, improved service usability, more health promoting behavior, lots of wonderful things. And of course, the negative things seem to have evaporated, but they did include that it costs more money and it goes slower. And of course, on PPI processes, co-design methods spread to other teams, creation of local action and steering groups. The negative impacts included some limited support and inconsistent practices. It varies a good bit. And a lack of long-term reporting. Measuring impacts. This was another kind of theme that we found in all of these reviews that, or we came upon that I wasn't necessarily focused on at first. I wanted to focus on those kind of 4 categories that we ended up with, but I couldn't run away from this. The evidence of impact is limited or weak. There's a lot of reviews that explicitly say this. Impacts are often not measured, and measurements are at least not reported. There's a big potential for confirmation biases. And there's challenges presented by a lack of consistent tools and measurements. For instance, there's 6 different PPI impact tools that were included in all of these different reviews. There's also a lot of qualitative methods to evaluate PPIE, things like focus groups. So conclusions real quick. The reporting practices and expectations for funders are connected to what gets reported as impacts. This is our kind of analysis. There's an emphasis on short-term impacts and outcomes. There are gaps on medium to long-term impacts. There's reporting on some negative impacts, but this is still limited. It wasn't invisible like I kind of expected. There were almost exclusively self-reported things, no empirical measures. There's more consistent measures, and measures over time will give us a clearer idea of what we're actually achieving. There's also limited data on financial impact. There's gaps in understanding patient experiences and influences on policy. So I'm going to go to Raj for his reflections. Raj, you said, my first point I've got for you, we weren't just consulted, we collaborated.
Yeah. Okay. I think just to put this into the context, we just give a quick background on our research advisory panel. It is a panel, really diverse in experience in any way, and brings an incredible diverse perspectives. There are 20 plus active contributors, and there is a separate panel for what we call our document reviews, so your virtual panel as well. So my reflection about, when I say we are, we consult or collaborate, actually, it is, the panel is so deeply and so well embraced fully by the entire, community of researchers, plus also the leadership team. In our director, Professor Rosalind Raids, you will find one of the most incredibly leaders who actually embrace PPI, and that makes it so well, for us all. So in this consultative, collaborative space, why do we say this? And I think the second point, it kind of really what has happened is that diverse perspective shapes, and it's an intersectional shaping of a lived experience about that diversity, whether it's a cultural, it's a professional experience, and all of that actually shapes the design and actually through the stages of that whole research cycle. And sometimes we are actually involved from the early inception all the way through to implementation, in some programs as appropriate, in some we're just co-design, etc. And why does this happen? And I think really the next point about this, actually about trust, about clarity, about inclusion, and a strong facilitation is really what makes it. And it makes it clear because everybody's voice is really heard. So seen, heard, and how do we know this? I said earlier, we have a record of what, you said this and we did this, but there's actually really quite what I would say, a really important feedback or follow-up loop. So we'll always get your rep panel either before or after the meeting to actually give you that language clarity or complexity of the presentation or any points that may be difficult. So it's about building that knowledge so we could speak confidently in the meeting itself. So it's that early, whether it's a pre-preparation or after the meeting, to reflect those kinds of issues. So I'll just pause there. Will, do you want me to continue?
Thanks, Raj.
Yeah.
So how about this? I'll read your bullets out loud to you.
Yeah.
Make sure you hit everything.
Yeah.
We weren't
Okay.
just consulted, we collaborated,
Yeah.
involved in shaping, interpreting, and communicating findings.
Yeah.
Trust, clarity, and inclusion made it meaningful. Felt seen, heard, and respected.
Yeah.
And that's what we got. And
Yeah.
that, you good with all those?
Yeah, I think we covered all those points. I think the
Great.
only thing to say is, it is important to note that to make this really meaningful, to make it relevant, and to make it impactful, it actually, that point about, we just don't actually shape, but we also have, opportunities to comment on findings and interpret findings to make it real.
That's great. And I've got your other what we've learned points here now too, Raj. I think you hit all these too, but I'll just say them out loud just for clarity. Lived experience brings depth and relevance. Inclusion improves research design and delivery. Trust and facilitation are essential. Measurement needs more consistency. Leadership is crucial for success.
Yeah, and I think that's point about measurement. I'll just say a little bit more. I think that requires real consistency, because there's a confusion. Does measurement include, are you on scope, schedule, and you're on timeline to complete this activity? Whose role is it to ensure that this project, this research study, this evaluation is delivered, in the scope as was defined, in the schedule, and in the cost? And what I think these measures talking about is really, from a public perspective, it will touch on all of those, but it is not really actually accounting or accountable or responsible for delivering those. It is there for public contributors to influence and to ensure that these things are happening.
So what I'll run through this one and then we'll go straight to questions because I'm watching the clock here. PPI, what this means going forward, PPI is not an add-on. It's central to better research. The benefits are really clear. True co-production requires commitment and clarity. We must ask what's really changing and who benefits. And this can impact can and should extend beyond the project. Huge thanks to our co-authors, Anne Buffardi and Dahlia Marks. Here's our official citation. I'll put it in the chat as soon as I stop sharing. Thank you all for being a part of this. We welcome your reflections, thoughts, questions. We got 2 minutes for clarifying questions. Does anybody have anything that they would like to check their understandings on?
I think we are running a tiny bit late, so we're just a tiny. You were very good on the. I'm not criticizing. I'm impressed by your timekeeping. But I did see a question in the chat that was about how big the PPI group was.
Okay.
How many members?
You want to know how many it is?
Yeah, there's a question in the chat.
On the RAP panel of which Raj is a member, I think it's 25.
Okay. And there's another question about confirmation bias. What does it mean?
Means like if you think that doing a PPI activity will be a good thing, and then you do a PPI activity, you will tend to think that good things came out of that PPI activity. It will tend to be difficult for somebody to notice the negative things that can come out of that. Things like intimidation, things like social kind of tension, things like not hearing the results, things like that.
Great. Thank you. So I'm going to hand over to Stan now, who will lead the discussion. As I said before, there's quite a lot of people on the call, so just bear with us, but we'll keep a close eye on the chat and we will help you, Stan. But I'll hand over to you now.
Thank you, Kristin, and thanks, Will and Raj, for this wonderful presentation. I have a lot of questions and comments, but I won't ask them now because it's your turn, guys. It's the turn of the people here to speak, ask, discuss. So I'm Stan Papoulias. As you can see under my name, I work for the Applied Research Collaboration South London. And I do research in PPI, but also I am a survivor researcher, a mental health survivor researcher. Anyway, so Will, I think Will and Raj have got 2 questions for us. And so we've got until just before, we've got about 40 minutes or so to discuss these. So there's a lot of people here at the moment. I see 74. So what we're going to try and do is, if possible, divide the time between the 2 questions. And this is the first one, and do sort of 20 minutes. Now, I'm going to invite people to put their hands up if they can. I mean, the virtual hands, so I can look at them. I see already at least 1. And where are the participants? Yeah, there they are. And then I think at the same time, Kristin and Kath will be looking at the chat and to see questions there. And just to say that we are not recording this part so that people are able